So I'm Dr. Jennifer Roelands. I'm double boarded OBGYN and integrative medicine, and I'm the founder and CEO of Precision Health MD. So I am actually one of the there's only 4 OBGYNs boarded in integrative medicine in the state of California. So that's a pretty fun, cool thing that I did, was to explore and go into a different type of medicine. But I'm also from a family that did not sort of support women in education. So I'm the only doctor in my family, and me with a professional degree.
Very cool.
Yeah.
Very cool. Okay, so talking about you and your career a little bit, we're going to go into the story time segment of the show.
Okay.
What is the biggest misconception in your field?
Oh my gosh, how much time do we have?
35 minutes.
No. So, I work with women in hormones. I do a lot with hormone therapy. And so the biggest misconception in my field is that hormones are unsafe, or that hormones are not for most women. And that's completely incorrect. So we still kind of have this unfortunate misconceptions about hormone replacement therapy from a previous study called the Women's Health Initiative. And I just think it really does a disservice to women, because we don't sort of pay attention to the new guidelines and understand really how things have changed in 23 years since that study was published.
Wow. And what would you say, what is something, or what was a time when a patient has maybe taught you something, or an experience with the patient challenged you and made you learn something new?
Well, patients challenge me every single day because I do functional and integrative medicine. So it's outside the box medicine. It's looking for the why of what's going on with someone. So there's always patients walking through my door that are telling me things that I didn't know before, or trying to understand exactly what I can do to help them. But a patient that really taught me something really, really valuable happened to me last year. I started working, doing telehealth with a patient who had apparently gone to multiple places in Europe. She had seen several doctors in the United States, and she was severely, severely depressed. And in the conversation, she told me, I am at my end. Like, I'm so tired of seeing so many providers. I don't understand what's wrong with me. And in that time, in 2 years, no one had asked her, when did all this start? And when I asked her that question, she said it started when I went through menopause 2 years ago. And for me, it was just eye-opening that she had been through all of this journey and no one asked a very simple question like, when did this start? What age were you? What was happening at the time? And ultimately, I'd put her on hormone replacement therapy, and she went from a person who had lost her job at a high-paying company and living with her mother in her 50s to moving out, getting a new career, completely changing her life. And for me, it was eye-opening to think, I got to ask those questions and I have to listen for the answer. So I learned a lot from that patient experience, that I need to spend more time listening than talking.
Wow. Okay, cool. And Dr. Jen, for the rest of these questions, just look at me for them. And the story you just told makes me wonder about how often is depression diagnosed without them seeing that it was truly a hormonal issue, a perimenopause or menopausal issue. How often does that happen?
A ton. Well, we know when women go through perimenopause and menopause, the rate of depression and anxiety is at least 4 times higher once you sort of go through this transition. So a lot of women are seeing their primary care doctor and told they have anxiety, sent to psychiatry, put on medications, but ultimately they still don't feel like themselves. They still feel terrible, and they're still struggling with other symptoms that are associated with perimenopause. So I see a lot of those women because they've been through that conventional route and realizing that something else must be wrong, and not really getting enough relief from just medications. And so I know, to ask the questions to make sure that I'm asking, when did this start? What is the other association? What else is going on with your body?
Well, it's crazy how underdiagnosed the hormone issues are.
Yeah, and also not just underdiagnosed, but women, educating women. I mean, many times women have come into me and say, well, my mom said she went through it just fine, so I shouldn't have any problems. Like, I don't know why I'm struggling so much, because she said it'd be fine. And I think we tend to sort of dismiss other women too. It's not just providers, but it's also other women saying, suck it up, buttercup, it'll be fine. And unfortunately, for some women, it's not.
Wow. Okay. And what would you say is one of the most common questions that you get from existing or potential patients?
How do I feel like myself again?
Wow.
I don't feel like myself. I used to be this bubbly personality, love hanging out with people, could sleep great, loved sex. Now I just want to be by myself. So I would say that's the most common question is, how can I feel like myself again? Please tell me I don't have to feel like this for the next 20 years.
And generally, what's your answer?
Let's do it. Let's figure it out. Because likely if they've come to me as an integrative doctor, they've probably tried their primary care doctor or they've tried other avenues. And so I practice whole body medicine. So it's not just about, hormones. It's about the whole picture. How do I get you sleeping well? How do I get you to eat well? How do I kind of fill those other voids that might be there?
Wow. Okay.
Having good sex, all of it.
The essentials.
The essentials.
Can you share about maybe a specific case that really pushed you to your limits and how you managed it?
Related to hormones specifically, or any case I've had?
I would say related to, actually, maybe any case you've had. Yeah.
That one's even tougher. Because I've been an OB-GYN for 16 years, so there's a lot of cases I can think of. I think for what got me started in this type of medicine, to be honest, was when I had a patient. I was struggling with infertility, and I had a patient that I had taken care of for 5 years was also struggling with infertility. Mm-hmm. And I sent them to reproductive endocrine, and kind of the answer was go lose weight and come back. Like
to be more fertile?
Mm-hmm.
Wow. Okay.
Like, go lose weight, come back when you've lost 50 pounds, and I can help you. And of course, she came back to me very devastated and crying, like, you sent me to this person and they told me this, and I can't even lose weight, and what am I supposed to do? And so that actually for me was the driving factor. And I was also suffering from infertility at the time. And so it was a driving factor for me to understand, does nutrition have anything to do with infertility? Does what you put on your face and your makeup what are the other things we don't know in medicine? Why is this seemingly healthy person, besides being overweight, struggling with not having a baby? So there must be more that I don't know. So that actually sent me into that spiral of going into taking classes on nutrition. I felt like I was in medical school all over again, having to do all these classes and try to teach myself specifically about how other things affect hormones, and ultimately actually help myself to get pregnant, but also this patient who ultimately spontaneously got pregnant, which was great for her. Wow. She didn't have to end up seeing the fertility doctor. So that's a pivotal case in my mind, because that was what started me on this whole journey of looking outside the box.
I could see how that could push you to want to figure something out. And since you mentioned that, if you mind sharing, your personal experience with the struggling with infertility, is that something you would be okay with sharing about or telling that story?
Sure. Yeah, I had one child, and then I was trying for a second, and it wasn't working. Things were not working. So I also went to an REI doctor, and that doctor said, you're young, you're healthy, it'll work. I said, well, it's been already a year. Like, I know more than the average person coming to see you. And so I knew there was something kind of wrong. So I ended up running out my own labs and finding out I had a thyroid problem. So I had high thyroid antibodies, even though my other labs were completely normal. So my thyroid labs were normal, but my antibodies were incredibly high. And actually had high testosterone at the time. So I essentially became diagnosed with Hashimoto's thyroiditis and also PCOS. So they had not done any workup for me because I didn't fit the typical picture. I wasn't. Typically, PCOS women tend to be overweight. I wasn't. I didn't have, my thyroid screening test was normal. So I was kind of missed in that avenue and very much dismissed. And so I ultimately had to figure out for myself, like, okay, this is something I need to work on in order to have a baby. So my fertility journey and that patient's were together, aligning to where we were both like, give us answers. Yeah. Like, what's wrong? Yeah. Why doesn't this happen? So for me, it kind of pushed me into learning a lot more that I didn't know before.
So how did you what would be the short answer of how you solved, these, like you found a thyroid issue, you found PCOS. Is that something do you still have PCOS? Mm-hmm. How do you manage?
Still a thyroid problem.
Mm-hmm.
Well, I manage now actually without medication because I realized that what I eat matters. So for me, inflammation drives a lot of my symptoms. So I had to figure out what was my drivers. And for me, what I eat avoiding certain foods for me, just
Wow.
focusing on my nutrition and focusing on getting to good sleep. You know, all the basics, like all the stuff your grandmother tells you, like go to bed, wake up at the same time, eat good, exercise. Like those things have to be in part of my lifestyle, or I'm going to end up on medications.
And then you
So,
were able to get pregnant after
mhm.
that? Wow, after making these lifestyle
Yeah, and
changes?
I have 4 kids, so it worked out
Wow.
again with twins.
Wow, that's incredible.
Yeah. I think, you know, we don't appreciate that in medicine, that there are other factors besides just medications. There are other things that can help you heal, and your body is very smart. We just need to figure out how you can heal yourself.
True or false? Urinary incontinence is an inevitable part of aging.
False. So not everybody has urinary incontinence. Some women don't. We as we age, our pelvic floor becomes weak, especially if you've had children, and so it is possible that you develop incontinence, but not every single woman has incontinence as they age.
Okay. Number 2, hormone therapy is risky. True or false?
It's a no. Majority of women can be on hormone replacement therapy. In fact, very few people can't. Even we can use vaginal estrogen for breast cancer patients. So unfortunately, the myth of hormone replacement therapy is, you know, if you have a family history, you can't have it, or you have high blood pressure, you can't have it, or your mom didn't do well on it, you can't have it. All of those are wrong. So most women are actually candidates.
Okay. Menopause symptoms can last between 1 and 4 years. True or false?
Well, that's kind of a tricky one because it can last longer than 4 years. So perimenopause is up to 10 years before menopause. So someone can be symptomatic and have symptoms that resemble what we call menopause symptoms for up to 10 years before they literally officially get their last period. And then most women are symptomatic for a good 5 years after that moment, for example. And then, you know, as women age like 10 years or so afterwards, symptoms certainly tend to abate a lot more. But, you know, theoretically, you could be having symptoms for 10 or 15 years.
What should you do if you're one of those women who are having symptoms for 5, 10 plus years?
Well, 80% of women are symptomatic and it's affecting their life in some avenue. So you need to find a menopause educated provider. You need someone, or perimenopause educated provider, someone who can help you figure out what is the right choice for you. Maybe it's HRT, maybe it's herbal therapy, maybe it's just lifestyle choices. You know, you don't know until you really meet with somebody and tell them, what are my objectives? What are my goals? What am I okay with?
Mm-hmm. Okay. Low libido is an inevitable part of menopause. True or false?
No.
No.
I have lots of women who, man, I have an 81-year-old that she's had no problems. I just saw her last
Going
week.
to town.
She is doing just fine. So it's not inevitable. I think a lot of women have low libido, but not inevitable for everybody. I don't like those sort of everybody has this or everybody doesn't, because people's menopause journeys can be very personal. Some people have terrible difficulty with sleeping, or hot flashes, or libido, or vaginal dryness, or, you know, they can all be very different. There's over 80 symptoms associated with menopause. So the journey is very unique and personal.
Mm-hmm. That's why we need you here. Okay. True or false? Perimenopause can start as early as 30 years old.
Yes.
Yes!
So realistically, if it's 10 years before menopause and the average age is 51, then someone can be 41 and go through menopause and then experiencing in their 30s perimenopause. So there's no cutoff for what it is. There's certainly women who go through what's called premature ovarian failure. So they actually have menopause before the age of 45. So you can imagine in their 30s, they're very symptomatic.
Okay.
Mm-hmm.
So what about, true or false, women who start their period earlier in life get menopause earlier in life?
So I'm going to say no. because it's not a set thing. So you can't sort of say, there's a lot of things that happen in those 40 years in between that time, right? Women who are heavier tend to have a delayed menopause compared to someone who's a little bit thinner. Genetics play into that, what happened with your mom, what is your health currently, right? So if you have other comorbidities, then certainly your menopause time can be affected. But this is a predetermined time. You have your ovaries and they have eggs and they are going to end at some point, and it's already predetermined. And in some ways you can affect it, but it is predetermined in that way.
Okay. And true or false, during menopause, women might need to take testosterone.
Yes, I love
Yeah,
testosterone.
baby.
That's a perfect one. Yes, love, love, love testosterone. No reason why in the United States there is no FDA approved testosterone. Australia, the UK, and actually I think there was a third one that just came in this year, all have not FDA, but approved testosterone uses for females. So it's hard to say, to me, it makes no sense to say estrogen, progesterone, testosterone are vital when you're 25, but at 55, testosterone just kind of falls off. I don't get that. It makes no sense to me. Especially when we know the benefits to the brain, to the muscle. There's so many libido. There's so many things that you can use testosterone for. So I don't see the point of why people are so against testosterone.
Yeah, it sounds like the U.S. verdict and position on hormones is just very behind.
Very behind.
Mm-hmm.
Oh, Australia. There you go.
Okay.
Yeah, to me, it makes no sense at all. And I don't know what there are companies who have tried to get the product through, and I don't know what the issue is as to why we have such villainized opinion of testosterone. As a women's health doctor and a woman, I think in general, we tend to dismiss women's health in general. If you look at the percentage of money towards research in women's health, is very minimal. So, we have 15 Viagra options, but we don't have any testosterone. So, it's just kind of crazy to me that people are so villainized about it.
Yeah.
I love my testosterone.
I see that. Okay, true or false? Birth control can change who a woman is attracted to or the type of man she's attracted to.
So I'm going to have to say no.
No.
From a medical perspective. So I have seen some of the data that people present for this concept, but from a medical randomized clinical control trial or any sort of really good scientific data, it's kind of lacking.
Okay.
Yeah. But we don't know everything in medicine, as always. So there are certainly people who are on that hill and feel like and you can imagine it's going to change your hormones. So that could affect who and what you're attracted to, but it's hard to prove that too.
Yeah. So subjective who you're attracted to. That's very subjective.
Yeah. How do you do a study anyway? And that's like, well, we met somebody at a bar, but then I met somebody at church, and then I met like how do you make these distinctions, like what you were feeling at the time or what was happening, or you know what I mean?
Yeah.
Have you had 4 bad boyfriends before that? There's kind of a lot of information that I think would be hard to specifically look at. But if someone comes up with a trial, fantastic.
Okay. Maybe it'll happen.
Maybe.
Okay, true or false? Perimenopause means you can't get pregnant.
False.
No.
So you can still get pregnant. You still have ovarian reserve. That's until you hit menopause, when you've had 1 year without periods. There's really, the chance of getting pregnant is lower than you would say when you're 25, but it's still possible.
Okay. Pelvic floor physical therapy.
Love it. 10 for everybody.
Why?
Because as we age, our pelvic floor muscles relax. So I honestly think right after a baby, 6 to 8 weeks, do pelvic floor, because you've now had the stress and the trauma of having a baby. Your body's changing, so you want to tighten the pelvic floor muscles again. And then, man, after 40, just go for it for proactive to prevent incontinence, prevent prolapse. Just overall, there's no downside to it.
Wow. Okay.
Yeah.
Ashwagandha.
I do use ashwagandha a lot, so I'd say about a 7. I think it's useful for stress, so it's an adaptogen. It helps with your body adapting to certain stressors. So for perimenopause and menopause women, it's great for them when they feel anxious and annoyed during the day and they need something to calm them down. It's a neutral adaptogen, so it's not one of those ones that make you sleepy or stimulated. It's a neutral one. So that's why a lot of these sort of women's botanical blends have ashwagandha, because in general it works pretty well for them.
Wow, interesting.
Yeah.
How about bioidentical hormone replacement therapy?
20 plus. Love it, love it, love it. Yeah. I think the amount, in my world, huge differences. I can tell you, majority of women who get started on it say, I feel like myself again. And I just think, yeah, yes. Bring it on.
Maca root.
Maca?
Maca root.
Yep. Love maca. So there's a lot of herbs that are helpful for perimenopause and menopause, and maca is actually one of the more well-studied ones. So not only does it sort of help with hormone balance, but it's actually great for libido, great for improving sexual health, men and women, both. And so I think it's a great one. I would say 8.
Okay.
Mm-hmm.
Laser vaginal rejuvenation.
Love, love, love. 9. Yeah. Done with somebody experienced and a good product.
What does it do?
So our tissue gets really lax, and also you lose lubrication because you don't have estrogen in the vagina. So it really causes the tissue to be thin and pale. And so when women have sex, they just have a lot more irritation, burning, less lubrication. And so vaginal lasers actually help from the inner layers to the surface. So it helps kind of rejuvenate the collagen that's in the vagina or below the mucosa, helps with tightening, so there's better sensation, and overall, it's FDA approved for genitourinary syndrome and menopause. So, yeah.
Okay.
Yeah, and it helps with incontinence too.
Okay.
Mm-hmm.
Mindfulness and meditation for symptom management.
Love it. 10. If you can do it, there's really amazing benefits. In fact, there's a lot of data even looking at it for hot flashes, decreasing hot flashes with meditation. Certainly breath work is also very well studied with hot flashes. And I think in general, stress and cortisol that goes through the roof when we're in perimenopause is a problem. So any mindfulness practice, whether or not it's meditation or it's breath work or just sitting in your own head, is helpful. I like some of the more alternative options where patients have things they can do. Like, I think meditation can be kind of overwhelming and difficult for people to think about. So sometimes it can be doing something like meditation while you're tracing your hand, or something where you're actually kind of not completely in your head. If that makes sense.
So there is a big positive impact even from something as simple as meditative practices.
Yeah.
Okay.
Yeah, sleep. That's what CBTI is. A lot of it is focused on mindfulness.
Mm-hmm. What about ice baths?
Cold plunges kind of thing.
Mm-hmm.
Yeah, in my world, I would say that's probably about a 5, because it improves your resilience. So it helps with metabolic flexibility. So cold plunges in some way, now not a lot of people like to do them because they're kind of miserable, but it helps with just adaptability, metabolic flexibility. So it is, I think that kind of aspect that goes into longevity medicine is going to be so much more appreciated in the next 5 years.
Acupuncture for hot flashes.
Very well studied. 10.
Okay.
Mm-hmm.
Fasting.
I love fasting. I would say 6 for most women can do intermittent fasting. Definitely good data on just metabolism for, in perimenopause and menopause, we have this insulin resistance issue that happens, and the inflammation issue that makes us gain weight. And so there's definitely good options for using intermittent fasting for that particular area.
Okay. Probiotics.
I love probiotics too. We haven't gotten too many ones that are so low. I would say for most women, probiotics can be very helpful because most of us are lacking in that in our foods. We don't eat a lot of fermented foods. We have gut issues when we go through hormonal changes. So I would say that's a 7.
Okay.
Ever since after my menopause, I have just been pissing myself. Doc, you gotta help me out. Either I'll be laughing or doing a sneeze, and it's really, really embarrassing at the worst times, and I've just been having to wear diapers. Is this normal? My doctors have been of no help. Please tell me if there's something I can do.
There are things to do. So incontinence, there are more than one type of incontinence. Stress incontinence is what she's describing, which is when you laugh, sneeze, cough, jump on a trampoline, and leak. So stress incontinence, first of all, pelvic floor. So there's actually pelvic floor therapy covered by insurance. So I would suggest that she try to put pelvic floor therapists near me, see if she can find a location that she can go to, and hopefully she has insurance like PPO to be able to just make her choice. But there is amazing resources online. So there's a person, her name is Dr. Bree, B-R-I, and she has over 200 YouTube videos specifically on pelvic floor. She's an amazing pelvic floor therapist. She provides amazing resources online, and I often refer patients to her just to get education to actually do some of it. She literally has exercises you can do at home online. So start with that, and try to find somebody who will work with you, because besides pelvic floor, there are certainly medications. It might require surgery. There might be vaginal laser. You might be a candidate. So you just need a good exam and a good provider.
Wow. So really focusing on just strengthening that region could do a lot for these like leaking situations.
Yeah, and obviously vaginal estrogen does a lot. So if you get the tissue back to where it was 10 years before, and it's able to, the muscles work a little bit better, the tissue is a little bit more healthy than people. I mean, in fact, there was that study that came out last year that said they literally just gave Medicare women vaginal estrogen to see how many ended up with UTIs, how many ended up with incontinence, and it decreased the amount of women that had UTIs and incontinence. So prophylactic vaginal estrogen can do a lot too. But That's where she needs to see a provider that can kind of do an exam, make sure we know that that's specifically the issue, and give her options.
And what else could women do for these issues you're talking about, like yeast infections or BV, etc.? What's misdiagnosed, and what can someone actually do about that, about if they're getting that all the time?
Well, if they're getting recurrent infections, vaginal and bladder, then in my mind, I always think about the microbiome. What's the bacteria that's in the vagina, or not in the bacteria in the vagina? Sometimes people use so many products that kill all the stuff in the vagina, then now we're always dealing with infection. So it depends on what we're talking about specifically. So if someone's just dealing with infection after another, then I often say, let's focus on trying to get the vaginal microbiome healthy. Because if you do, you're going to also affect the bladder health. So making sure that, do they need a vaginal probiotic? Do they need an oral probiotic to help with their gut? Do they need to get a pH balancing gel? Like, what is the actual way we can kind of reset tissue?
Okay.
Yeah.
We got another question.
Hi, it's Angela. I'm 35 years old, and I have been experiencing hot flashes, mood swings, brain fog, and these seem like the symptoms to perimenopause. I just don't know. I feel very young. Now I get my period when I was 10 years old, so I heard maybe it's possible that women who get the period early can get perimenopause, but it's giving me a lot of issues. I don't know if I'm jumping the gun or not. Please tell me how I can tell the difference.
Well, that's a great question. And I'm glad that Angela said that she needed help with that, because a lot of women don't know that they're starting perimenopause. They feel hormonal or feel things are kind of not like they used to be. A great resource, honestly, to start with, there's a great book by Dr. Mary Claire Haver, called The New Menopause. And what I like about that book is it starts to kind of set the stage about what's happening to you in your 30s, 40s, 50s. This is what is sort of what perimenopause means, or what you might be going through, and you might need to see a provider to talk to them about getting tested for your hormones, or even just discussion about where you are specifically. The bummer part is we don't have a test for perimenopause specifically. So you can't take a test and say, oh, I'm perimenopause or I'm menopause. There's no test. There is a test that says that you are officially in menopause if you do an FSH blood level to at least a month apart, or you don't have a period for 1 year. But perimenopause, there's no test, which is unfortunate because we don't have any way to say that.
So you can't see that even in blood test or checking hormone levels? You can't tell?
No, because, the hormones are a roller coaster. So as we go through perimenopause, they're going down, but they're doing this the whole time. So you have times, like I could check someone who's 45's blood once every 2 weeks consecutively, and they may have a high estrogen, a low estrogen, a normal estrogen. It's all over the map. And so unfortunately, you don't have a way to say, yep, this is for sure happening to them. And that's why perimenopause is made from a clinical diagnosis. So we look at age, we look at symptoms that they're having, and we try to determine, are they having changes in their period and perimenopause symptoms, and put them in that category, in other words.
Wow, tricky.
Yeah. It is tricky. And, there's no downs. I mean, whether or not to test people with labs or not is controversial. There's some providers who are like, don't do it because Western medicine says don't do it. But I have a lot of patients who want to know, especially testosterone, because you can't measure just from your period what your testosterone level is. So I do it. And if you're going to test hormones, make sure you know what day of your cycle that you're testing them, because a day 3 estrogen is very different than a day 22 estrogen. So you need to have somebody who understands the cycle variation of those hormones and when you're testing, to make sure that testing is effective.
Okay. We have, I believe, one more question for this segment.
Okay.
Since my menopause hit, my sex drive is just poof. It's very hard on my marriage. I feel pressure from my husband, even though he's a sweetheart, he doesn't say anything. And my girlfriends tell me about testosterone therapy as a secret weapon, but I always thought testosterone's just for men. I'm just scared to start doing something like this and develop weird manly side effects. So any help is appreciated.
Yeah, so very, very common to have low libido. The medical term is called hypoactive sexual desire disorder. Just basically means over a 6-month time frame, you have less interest, less desire, less arousal. And so there are kind of subtle changes or subtle differences between why someone has libido. I actually frequently talk to my patients and kind of use a funny analogy, saying that men just need testosterone and someone somewhere in the building, like your partner somewhere in the building. We're a little bit more complicated. We need estrogen, testosterone. We need to look cute. The kids need to be asleep. The dishes need to be done by our partner. Like there's about 9 different parameters that have to be met. So it's important to understand why someone's having low libido. Is it because they're not sleeping? Because if you don't sleep, you really don't have interest in having sex. Is it because they are interested, but really they can't achieve an orgasm? Is it that lubrication or pain during sex is a deterrent to wanting to have sex? Is it you don't feel good in your own body? Maybe you've gained 10 pounds and you don't feel great, so it's hard to want to imagine someone seeing you naked, even your husband who you love. So there's a lot of different components to low libido. There are 2 FDA-approved medications for low libido that adding Vyleesi. So there are options that are non-testosterone if you're kind of concerned about testosterone. But frankly, I love testosterone. I use it a lot with patients because it improves not only flow to the genitalia, but also to the brain. And so not only do you sort of feel like things are awoken again, but down below, but you also kind of go, yeah, this is rewarding. I remember how rewarding this was. So the brain kind of remembers it's just as good as a chocolate chip cookie. Like, we forgot this, but it's actually really good. So it's very useful for women. But in using testosterone, you definitely need blood work, because the worst thing you would want to do is give someone testosterone and they suddenly develop hair growth. Nobody wants chin hairs or hairs where they don't want them. So I always do baseline blood work for that to make sure that giving testosterone is the right answer of them.
Okay.
Yeah.
Okay,
there are a lot of options. You just got to find somebody who can help you walk through it.
Right. Okay, so here's a popular video about menopause, and let me know what you think about it.
I would have done more strength training in my 30s.
Strength training.
It is so important for bone health. as we age.
I know now that we will lose bone density. I wish I paid attention to the sugars in my diet. If I realized then the impact of nutrition, good nutrition, on my life.
Yeah, I mean, all fantastic points. Strength training, strength training, strength. I mean, I couldn't say that more. It's amazing. You have to start strength training when you're younger. I think the people that are in my era, the 40s and 50s, are, 40 and 50-year-olds, we were taught cardio, cardio, cardio. We all, had our tab soda and did cardio and had our low fat, Dannon yogurts. And so most of us were not big on strength training, but you lose muscle mass as you age. You certainly have lower bone density. And so if you're not doing something to lift weights, strength training, you're going to be in trouble.
There are 34 symptoms of menopause, and here they are, so you know them, and you know you're not alone. If you're dealing with one of them, 10 of them, or 34 of them. Hot flashes, night sweats, irregular periods, breast soreness, bloating.
Thoughts so far?
There are actually more than that. Unfortunately, there's a ton more. So I'm sure she's going to list them all, but there are some, and even ones that are unusual, like ringing in the ears, itching all over your body.
How many?
So if you look in literature, it's like 80 symptoms that are associated with menopause.
Wow.
So yeah, I mean, those, we kind of have these common ones we think about: hot flashes, night sweats, low libido, vaginal dryness, but there are other ones. People develop more autoimmune issues. They are susceptible to getting sick more often. I mean, there's many more that are kind of outside the box.
That's crazy.
Mm-hmm.
Okay.
So think about your mom tomorrow.
Perimenopause destroys women's mental health, and then menopause destroys their physical health. If you're starting to lose your hormones, and you'll know because your body will tell you you'll have symptoms, the earlier the intervention, the better the outcome.
So earlier the intervention, I like that part that he's saying. I would say, I try to avoid words like destroy your life, right? I mean, I think, I don't think anybody who's going through perimenopause wants to feel as though their life is destroyed from there. But certainly the earlier you intervene, the better.
The average age of menopause in this country is 51. Normal menopause is anywhere between 40 and 60, with most women experiencing menopause between the ages of 45 and 55. So now remember, menopause is a clinical diagnosis. 1 year, no period, is menopause. Perimenopause are the years leading up to menopause that demonstrate the hormonal fluctuations that we see.
She's absolutely correct. Yeah. Average age is 51. Can be, as small as 1 to 2 years before you hit menopause is perimenopause, or up to 10 years. So yeah, that's correct.
Hi, if you're a woman in your 40s approaching the menopause, or you are menopausal, there are 3 supplements that you should be taking. I'm Manisha, and I'm an evidence-based nutritionist. And I went through the menopause when I was about 46, which is about 6 years ago. And yes, if you've done the maths right, I'm nearly 52. So I wish that I knew that I needed to take these supplements back then, because they are absolutely essential. So let's find out what they are. In no particular order, the first one is magnesium. If you're struggling to sleep because of your menopausal symptoms, magnesium will help to relax you. It will help to promote sleep. It will help to relieve constipation, and you can buy it in different forms. So this one is a cream, you can buy it as a tablet, and you can buy it as a spray. Then we have vitamin D. Now, if you buy vitamin D with K2, it helps with vitamin D absorption. Now, there are lots of benefits of taking vitamin D, so I'm just going to mention a few now. The first one is it helps to improve your overall immune system. Then it also helps to improve joint pain and bone pain. So if you're experiencing bone pain as you're getting older, then this is a great one to take. And then finally, it helps to improve your mood and your overall mental health. It also helps to improve energy, and you should see a difference in your energy levels as quickly as within a week. Then we have omega-3. Now, it's really important.
Okay, so you got those 3.
Mm-hmm. Yeah, I love it. So Fab 5 nutrients in menopause, she hit 3 out of the 5. So omega is incredibly important, great for your brain, great for your joints. And, depending if you're not eating enough omega-3s for sure in your diet. Magnesium, love it. There are many forms of magnesium. So magnesium deficiency is fairly common in the United States, and certainly doesn't help when we go through menopause. And then for sure, vitamin D. A lot of women are deficient in vitamin D in menopause. So I love them all.
Okay.
Yeah. I would say you're not alone. That there are a lot of women that are going through could not if we're just talking about menopause or perimenopause specifically, a lot of women are going through that with you. Find your tribe. So whether or not it's a tribe of women to support you, your partner, or physicians, like find your group to support you. And it doesn't mean it has to be menopause too. I think in women's health, could be talking about PCOS or endometriosis or just hormonal PMDD. So making sure that you're not alone and find your tribe.
Okay. And for things like you said, PCOS and PMDD, would you emphasize the importance of how nutrition and like anti-inflammation could be the solution to live with that?
Of course. I mean, you can't. So I even have this conversation. I do aesthetics as well in my practice. And so I tell patients, you can spend $2,000 on a laser package, but if you're going to go and eat McDonald's for the next 3 weeks, it does nothing. Skin health is connected to gut health. Hormones are connected to gut health. So what you eat matters. It's a medicine. Food is medicine. So you have to look at it as part of your treatment plan.
And would specifically doing an anti-inflammatory diet help with things like PMDD?
Yes. Yeah. I mean, anti-inflammatory diet encompasses a lot of different diets. It's not just one. I mean, the Mediterranean diet is the most well studied, but there's no downside to doing an anti-inflammatory diet. None. Okay. Especially if any hormonal problems, there's no downside.
Wow. Okay. And is there one more kind of message that you would have to everybody?
You got some hard question on this one. So, okay, my two were find your tribe, you're not alone. And, be your own doctor. Seriously, be your own doctor. Advocate for yourself. Find the person or the people that make sense, but be your own doctor. Understand what are your options. Try to make sure you see the person who's aligned with you, but you are your own doctor.
Mm-hmm. So get educated, listen to your body. Mm-hmm. Don't just accept a one-off piece of advice.
Mm-hmm.
Wow. Okay. All right. Well, where can everybody find you and check you out?
I have a company called Precision Health MD. So I run a medical clinic, a functional and integrated medicine clinic. And then, so the Precision Health MD, OC.com. And then I'm on YouTube. So Dr. Jen MD, and then Instagram, Dr. Jen MD.
Okay. And you're in Orange County?
I am.
Cool.
But I'm licensed in 11 states.
Wow.
So yeah.
All right. Thank you, Dr. Jen.
Thank you.